Good morning, everyone, and welcome to Maine Public Health Association's 2020 annual conference. If this is the first time you're joining us this morning, and welcome back to anyone who was at our first session. We really appreciate the attendance and participation we've had so far as we continue into week 3 of programming. A couple of reminders before we begin. If you're interested in closed captioning, we are providing that, and that's information is available about that in the left-hand menu of the conference website. We do ask that you please take the session evaluations, and you can find those by clicking the feedback button in the same spot where you accessed our live stream for today's presentation. We ask that you do that evaluation whether or not you're seeking CMEs. And lastly, we will take questions throughout today's presentation and end with a Q&A. You can enter in the questions at any time using the Ask feature, and we will get those to Elizabeth and Patricia at the end of their presentation. But with those quick announcements, thank you to Elizabeth and Patricia for being with us this morning. Patricia O is a program manager at the University of Maine Center on Aging and an age-friendly consultant with AARP Maine and Livable Communities. Elizabeth Singer is a community relations coordinator at Cary Medical Center and a coordinator with Age-Friendly Caribou. And they'll be talking with us today about livable communities for healthy aging. So thank you both so much for being here, and we're looking forward to your presentation.
Thank you very much for that friendly and welcoming introduction, Heather. I very much appreciate it. Both Elizabeth and I appreciate it. I am Patricia O, and I'll be introducing the topic today. My colleague, Elizabeth Singer, will share the work on age-friendly communities and age-friendly healthcare that's happening specifically in Caribou. We have no disclosures with regard to commercial relationships to mention. And this is what we're going to cover today. We'll start with a broad overview of rural livable communities, and then move on to age-friendly communities and healthy aging, and then spotlight age-friendly Caribou and the age-friendly healthcare program that has been started at Cary Medical Center. We're living during the greatest public health success story that could ever be imagined. A 10-year-old child today has a 50% chance or more of living to be 100. We're not only leading longer lives, but we're also leading healthier lives. That longevity dividend is a tremendous asset for our communities. Older people with skills and talents and a lifetime of experience making change want to remain active and engaged in the community as we all age. Community has a very critical role in health and well-being. Healthy communities foster healthier lives. When people are enjoying their best possible health and well-being, they can also contribute to the health of the community. So that's, in a nutshell, what age-friendly communities are trying to do, is create those environments where people can live their best lives. And that brings me to poll number 1. Can you please launch that? Thank you, Frederick. What makes your community a great place to live? What makes it a place where people can grow up and grow old safely and enjoy the best possible health and well-being? What makes your community a place where people want to spend a lifetime? So just ask you to vote on whichever one of those items you think is the most important. And next, we're going to talk about what exactly is age-friendly. Age-friendly initiatives are intentional municipal efforts to make the places, the organizations, the groups, and the social institutions in a town, city, county, or state more responsive to longer, healthier lives and inclusive of people living with disabilities. Especially in rural areas, we really are a car-dependent culture. The alternatives for people who cannot or choose not to drive an automobile are very limited. And most of us would rather not drive on the back of the tractor. In some rural communities, even if you are physically capable of walking to a local store, dodging traffic can mean taking life in your hands. We have been building homes and investing in services and developing infrastructure for the forever young and able-bodied for decades. One of my colleagues refers to these communities as Peter Pan communities because we're obviously going to be forever young. However, what we know is that people of all ages want to enjoy valued activities and have a reason to get up in the morning. That can be hard to do, though, if the buildings where meetings are held aren't accessible, if there's no public transportation, or if in this era of technology, it's difficult to find out what's going on in the community, or even to identify the resources that are available to help. If you look at the middle picture, if we want to live our best lives and we want to get recreational opportunities, but we perceive that gyms are only places for the young and able-bodied, we're not going to go to them. And in the last picture, you see the lady sitting there with Born to Rock on her shirt and then a red circle Xing that out, because none of us are actually born to rock. All of us are born to be active participants in our communities. ARP encourages communities to make changes in the physical, social, and service environments that allow people to be as healthy as possible and to live their best lives. And ARP does that work through the ARP network of age-friendly states and communities. So now we're going to close the poll. In 2005, and I'm going to give just a little bit of a background about what age-friendly communities are and where this movement came from. In 2005, the World Health Organization engaged in a participatory research process that included more than 2,000 older adults, caregivers, and service providers in 33 cities and 22 countries around the world. They asked people what areas of community are most critical for people to thrive in the community. These 8 core community features, which are also known as the 8 domains of livability, were identified. 2 years later, in 2007, the World Health Organization launched its global network of age-friendly cities and communities to encourage municipalities to improve the built, social, and service environments, and to encourage people to remain as active, engaged in the community as possible. ARP became a country affiliate of the WHO program in 2012 and started to recruit communities to join the ARP network of age-friendly states and communities. Municipalities that joined promised to include an aging lens in community and economic development. They are not age-friendly nirvana. They are all communities that are working very hard to become a better place for people to age. And when I look at the poll results, access to health care was one of the areas of community life that some of you thought was important. Community support and health services, and outdoor spaces and buildings. It's exciting for me to see the results of this, because it means that you absolutely get the importance of those outdoor spaces and buildings for people to really be able to access every part of the community. I also got really excited when I saw that respect and social inclusion was included as one of the aspects of community that you thought was important. Today I saw a cartoon of one of the political candidates pictured in a wheelchair in a nursing home, and the supposition there was that obviously if somebody was in a wheelchair in a nursing home, they're no longer important. Well, that's not true. And everybody has a role in community. Everybody needs to feel needed, no matter where we're living and what we're doing. So now, as of September 27th, 2020, so about a month ago, 393 cities and towns and 78 counties in the United States had joined the ARP network of age-friendly states and communities. That figure does not include the 6 states and territories that had joined. Of the 393 cities and towns, 171 had a population of less than 20,000, and 72 had fewer than 5,000 residents. The smallest community is actually not in Maine. It's over the border in New Hampshire, Little Hart's location in New Hampshire, which is home to 43 people. 14 of the 78 counties were characterized by the US Census as more than 50% rural. As you can see from the rapid growth of the network, this truly is a movement across the United States, and it is not just a movement for cities, even though when the WHO created this program, they were imagining it as a city-centric program. It truly is a rural movement as well. More than 70 Maine communities have joined the ARP network, and a similar number of communities throughout Maine are either contemplating adopting a similar model or have implemented a program in their community without necessarily formally joining. So this is a thing, and it's exciting. And later on, you're going to hear more about what that looks like in Caribou. I wanted to talk a little bit about, who's doing this? How are they doing this? So as you can see, the majority of Maine's age-friendly communities are actually volunteer-led. And Caribou is a little bit different. Caribou has a wonderful healthcare backbone organization to help them move the work forward. The vast majority, even if they do have a backbone organization like healthcare in Caribou, they are still very heavily reliant on volunteers. These initiatives require a very strong partnership with their municipality. For example, in age-friendly Bucksport, stores are encouraged to be accessible to people of all ages and abilities. That wouldn't be able to happen if the municipality wasn't behind that. They've also made a lot of changes to their infrastructure so that people of all abilities can access the outdoor spaces in Bucksport. Age-friendly communities value older residents and the contribution that we all make to the community. And in several age-friendly communities, they've passed tax abatement programs to help older residents who are struggling financially to remain in their homes. Again, that kind of initiative couldn't happen without municipal support. Although the work really does require a lot of municipal support, these initiatives also depend on a wide variety of local partners, such as libraries, historical societies, schools, healthcare, and voluntary organizations. They also form strong partnerships with regional organizations, such as the Area Agency on Aging, funders, such as the Maine Community Foundation, and I'll talk a little bit more about partnerships later. I often hear people say, okay, this is like that old tree thing that they used to have where you were a tree-friendly community or you were a business-friendly community. People join, you say yes, and then they don't actually do anything. Well, it's not true. It may be true. I don't know. It may be true in other parts of the country, but we are Mainers, and we do not join and do nothing. We really get involved. One of the values that I often hear in age-friendly communities is the value of neighbor helping neighbor. Another I hear is the value of frugality, and another is Yankee ingenuity. All of these main values come together, and communities have put together initiatives in all 8 of the 8 domains. One thing I want to point out, though, is that a community could be, for example, could have a program where they're doing a tax abatement program, like the one that I just mentioned. And that would involve the housing domain. It would also involve respect and social inclusion and could include civic participation and employment. So each initiative may involve multiple domains, but certainly the Maine communities are very active in all of the 8 domains. You'll notice that the fewest communities actually do anything specifically to address respect and social inclusion. However, the argument has been made by my colleagues and by others that whenever a community joins the ARP network of age-friendly states and communities or launches a similar initiative, that they really are saying to their residents that people of all ages and abilities are included and welcome and important. So as you saw, most communities are working to improve access to communication and information. Increasing access to evidence-based programs, starting a congregate meal program, partnering with the AAA to increase access to Meals on Wheels, or a evidence-based fall prevention program, delivering food commodity boxes, sponsoring a dental clinic in a rural community, and starting a durable medical equipment loan projects are all ways that age-friendly communities have tried to improve community support and health services. In the communication slide, one of the second picture that you see is of a lady who's sitting in a wheelchair and who's exhibiting a display of adaptive equipment. And so we're not only getting out communication and information about the fun things that are happening in town or the municipal programs available to support older folks, but also about resources that can make everyday life just a little bit easier. Okay. Transportation is a challenge throughout our state, and communities are working to tackle it in a variety of ways. One way is through the creation of volunteer transportation networks. In outdoor spaces and buildings, communities are doing things as simple as adding ramps to a community center, which is what you see in the final picture, or putting benches in the downtown and parks to encourage people to get out and about. You'll notice that this young man is standing very proudly behind his benches. He was an Eagle Scout, and he made those benches to be distributed throughout the community. And so that was, for that community, it was part of their outdoor spaces initiative, but it was also part of respect and social inclusion. Maine has some of the oldest housing stock in the nation, so it's probably not surprising that communities are finding innovative, low-cost ways to make people's homes safer. Almost 2/3 of Maine's age-friendly communities address social participation in one way or another. To do that, they're promoting group recreation activities like this walking group that you see in the final picture, and creating opportunities for civic engagement, like this group that's working to establish a community garden. Everyone has something valuable to bring to the table. The expectation that people will make a positive difference encourages involvement in community life, even for people at all stages of life. So young people want to make a difference, and so do older folks. It can be, and in these two pictures, one is an example of a group of people who are participating in a mailing that the age-friendly committee was doing, and the other is a job fair specifically targeting older adults. And then in respect and social inclusion, this lady is working at the youth center in her community and showing young people how to sew. The things that they make are being donated to the warming shelter in their community. So I just went through really quickly to give examples of what communities are doing in the 8 domains of livability. So my next thing is, how do communities actually make these changes? These are the tools that successful age-friendly leaders such as Elizabeth have told us help them on their age-friendly journey. Age-friendly communities build on the strengths already in their community to meet the needs and wants of people. They make changes in the way that people prefer. The very first step of this is to listen to what people have to say and learn how your community wants change to happen. Age-friendly leaders are some of the most generous people you'll ever meet. They have gained skills and experience that they're anxious to share with other communities. With more than 70 communities in Maine, no one needs to reinvent the wheel. The leaders who keep their age-friendly teams and volunteers engaged and enthusiastic about the work know the secret of fun. They celebrate the contributions of their volunteers, and they also make their meetings and their activities fun. They try to plan things that are fun for people of all ages, such as a senior prom for young people as well as for older folks. And even with the help of Yankee ingenuity, communities need to connect with funding partners to help them do the work. In Maine, the Maine Community Foundation and ARP Maine have consistently offered mini grant programs to help communities move their work forward. So these are sort of the tools that communities use pre-pandemic. Post-pandemic, what they learned is that there were a few things that were really important. It was important to do team building. Even if that meant reverting to Zoom or conference calls, it was very important to do team building. In the second picture, you see 2 police officers who are delivering food commodity boxes. A lot of communities found out that in order to do the work, they needed to reach out and engage some partners that hadn't been involved before. It was sort of an added bonus for many of the communities because it meant that those partners knew about their work, and some of those partners, as in the female police officer that you see in the picture, have actually joined the committee, so it's a good thing. Some of the communities already had existing programs, and what they needed to do was adapt those programs to the pandemic, and that's what you see in the third picture, the lady standing behind the window with all the pictures. Instead of having a congregate meal program, they offered a hot delivered meal directly to the home, but they also brought pictures from the island school children so that the woman would still feel like she's part of the community. And they did that for the 60-odd people on the island who received who used to participate in the congregate meal program and are now receiving the hot meals in their home. And they also came together to meet the needs of their community. 79% of age-friendly communities in Maine actually continued to do their work or even develop new programs during the pandemic, which is something I have found extremely impressive, knowing how hard it can be to move work forward during the pandemic. And now I am going to turn it over to my colleague, Elizabeth.
Hi, thank you, Patricia. That was a wonderful overview of age friendly and our age friendly communities. And Patricia has been a huge guiding force for us through this, and it's something that we have been very grateful to have people like Patricia and also partners in other communities throughout the state. Because like she said, we don't need to reinvent the wheel. And so we've been working closely with a lot of other communities, whether it's right here in Aroostook County or even people as far south as, Saco and even Jackman. But here in Caribou, I have been coordinating the Age Friendly initiative for about a year now, maybe a little bit longer. It seems to be a little bit, it's kind of running together, but I've definitely have enjoyed every moment of it. And if you want to move the slide forward. And one of the things that's great about this is that ARP kind of gives you a template to work from. And so it makes it very easy for you to be strategic about what you're doing, because you don't want to just jump in and think, oh, you know what, let's try and help people find employment. But in your community, you might not need that. And so what we did first was we did a community survey, and then we also had focus groups, and we oh, actually, can you go back one more slide? I think we're up. Yeah, there we go. Yeah. And the survey, we had about 320 people who responded, and for the most part, they rated Caribou as good. We would like to see that as to go up in terms of a community that is wonderful for place to live. For people as they age, so we want it to be excellent. We want people to think of this is a great place to, raise your family and retire and stay here for your entire life. But also with Caribou being a small rural community, when we asked people how long they've lived here, the majority of people said that they've been here for 45 years and more, which really wasn't surprising considering that we do have a large part of our population is over the age of 65. But one of the things that we thought was really positive, if you combine the 15 years and less of how long people have lived here, then we're looking at about 20%. And so that's kind of showing us a little bit of a trend of people moving to the area. And we have seen, real estate kind of getting really hot around here. I think people are trying to escape the big cities now. But it's nice. It's nice to see that we have this blend of people that have been here, are true, uh, members of the community, have been here their whole lives, but then we also have people that are coming in. And so we can all work together to really make our community an excellent place to live as we age. And then at this point, we're going to do a poll. And it's kind of in line with what Patricia had asked earlier. But if you were to pick one of the following, which would you say your community needs the most help with? And so if you want to go to the next slide, as people are responding to the poll. When we asked a similar question of the people in our survey, the following items, can have an impact on the quality of life for older residents. How important are these to you? And in a rural area, the number one thing was access to health services. Now, in a place like Portland, access to health services might not rate as high because you have excellent health services there. And here in Caribou, we have a wonderful hospital, and Pines Health Services and other stuff that people have access to. But we might not have specialists, or also there's other things that go into that in terms of getting access to healthcare. And then we also noted that being able to stay in your own home, like Patricia said earlier, we have older houses, large farmhouses that are going to be hard for people to maintain as they get older, but they've also probably been in your family, like my husband's family, they had a farmhouse that had been in the family for 100 years, but it's hard for people to maintain. And if the younger generations don't stay there and they move away, it's also harder for people to stay in their own homes. So it's something that is important for us to look at. And being in a small rural community, also that lack of isolation is something that we're looking at. And so if we want to look at the poll, let me see here. We had some people, and the top one was housing, being able to stay in your own home. Of course, aging in place is very important right now. Let's see, transportation. Yeah, that's a huge one up here too. Access to quality and safe outdoor spaces. Social participation and lack of isolation, and civic participation and employment also came in. But from what you all said, housing was number one. And for us, that was also top, right after the access to healthcare. All right, so Patricia, if you want to go forward one. All right, so while we're doing all of this research and pulling together our action plan and all of that, one of the things that we wanted to do was some quick wins for our community so we can kind of get our name out there, but then also let people know that there is an age-friendly initiative and that they can become involved. One of the things you see on the left is a resource that was actually a magnet. It was really simple. It's just cardstock with like a little business card magnet stuck to the back. And it's so popular that we're actually printing more and getting those out in the community, whether it's, you know, having a stack at the library or at the town office. They're easy to mail and people love them. And so we're getting those out everywhere. And when Patricia came up for a couple of our meetings, she brought these wonderful books with her. And we were also able to get some other books that we donated to the library. And the books focus on, you know, things from healthy aging to ageism, you know, just things that some fiction books that, you know, have kind of like a maybe you know, the main character is an older adult, and so it's something that's just fun. We put our age-friendly caribou sticker in all of the books so everybody knows that they were donated by age-friendly caribou. And then one of the things that we're kicking off right now is our sand bucket program. We are partnering with Meals on Wheels to deliver these sand buckets. And so Public Works here, we can get this sand salt mixture. And then if you go to like your restaurants nearby, some of the, like, let's see, we have a restaurant here where you can get pickles in the buckets. And so they have all of these buckets just filled with pickles. And then when they're done with them, they don't know what to do with the buckets. So they gave them to us. And that was something that for us was exciting. So we were able to get these free buckets, and Public Works is going to fill them up for free. And so we're going to get those out into our community. And do you want to go forward one more? Thank you. And one of the things too is we have a lot of great local resources. So there's no point in trying to reinvent the wheel. And also it's another way to really take advantage of what's already working in your community. So one of the things is our Fort Fairfield, which is a neighboring town. They have a home modification program that they have a grant for. So we've been helping them promote that because they will come into Caribou and surrounding areas to help people modify their homes so that they can stay in their home safely. And then also there are events up here. Of course, with COVID, we haven't had nearly as much, but like Thursdays on Sweden Street, the Take It Outside adult series with our rec center, things that we can partner with that gets our name out there, and we can support, you know, some of these great things that are already going on in the community. So if you take a look at what's going on in your community and kind of partner with them, you're not trying to create new programs on top of what's already going on there. You can all work together and make what's going on, make it even bigger and better. And so if you want to go to the next slide. And then one of the other things that I work on is a zero suicide initiative. And unfortunately, that's something that is a crisis among older adults. If you ask people what they think is the top age range for deaths from suicide, they might say it's, you know, younger adults or even teenagers, but actually the top group is white men over the age of 75. And so that is something that is concerning, especially in an aging community. So we are doing more to kind of just get information out there. We want people to realize that it's something that we can talk about, address the stigma around it. So we've had, you know, articles that have gone out, radio ads. We've also been using our social media to kind of get information out there so that people have the resources, and then maybe they start talking a little bit more about this serious issue. And if you want to go to the next slide. And one of the top things that we are looking at addressing is the access to healthcare, because that was something that was rated as the most important thing for people in our community. And with that, we have to also look at transportation, access to insurance, whether it's letting people, have, access to information on how do you get Medicare, what do you sign up for Medicare. That's just a whole kind of big puzzle in itself. Do we have access to specialists, and whether it's telehealth, things like that. Also, mental health care. Like one of the ladies that contacted me about the stand bucket for her father, she said he would never ask me to, he would never ask himself to do this. And that's something that we see a lot throughout Maine, is people are like, I'm tough, I can do this, I don't need help. And so if they're not willing to ask for a sand bucket so that they don't slip and fall, are they going to be willing to ask for mental health care? And probably not. So what we need to do is really start working with some of our providers and making sure that they are, have some of the resources so that they can then guide their patients to when they need, mental health care. And, letting people know it's okay to say that you're feeling depressed. It's okay to say that you're anxious. And if you need help, to get help. Also, chronic disease self-management. If you have a chronic disease, and you might not have access to the specialists that you need, or it's too hard to get to them. We can't always travel to Bangor all the time. But if you can do some things to help self-manage and have good coordinated care with your preferred provider up here and the specialists in Bangor, then we can have kind of that whole mixture together so that everybody they're managing that chronic disease well, and it's something that isn't going to impede them. And then, of course, programs to help people get and stay healthy. We want to make sure that everybody, has access to things like the Take It Outside series with our rec program, or, with pickleball, or getting together for cribbage, things like that, so that, they are getting out and about and they're doing what they can to stay healthy. All right. And recently, Cary Medical Center was designated as an age-friendly health system by the American Hospital Association. And kind of like what AARP does with the 8 domains of livability, with the age-friendly health system, they have the 4 M's framework. And so they look at, mobility, mentation, medication, and then what matters. And so our nurses and our nursing staff and our leadership have gone through these 4 M's and have identified things like with mobility, do they need to work with a physical therapist? Are they a fall risk? And, in our hospital, we have the red slipper program where they get a red socks if they're a fall risk while they're staying in our hospital. Medication, do they understand the medications that they're taking? Do they know how to take them properly? Maybe the medication they're taking might make them more of a fall risk. So what are they doing to make sure that those things are working together and that they are getting that coordinated care? And so do you want to go to the next slide? It's kind of awkward having to but all right, so continuing on with the age-friendly health system, with the age-friendly care bill, we are able to kind of support that, because there's a lot of things that are going on in Cary Medical Center that it's policy-wise, but what as an age-friendly care bill, what can we do to help? So there are some things where you can get some information out, like on safe home medications, how to properly store your medication safely. There's also Living Well for Better Health classes, and myself and one of my colleagues, we are certified to teach these classes on chronic conditions and chronic pain. And again, that's also like a kind of letting people learn how to self-manage, with living with some of those issues. Also, we have some support groups for like dementia caregivers, grandparents raising grandchildren. And then we have our Healthy You programs. And those are excellent programs that, offer a variety of information. Like we just recently wrapped up, 100 miles in 100 days, where people logged in, 100 miles. If, you can walk either a mile a day, or you can walk 5 miles or whatever you wanted to, but over those 100 days, you needed to walk 100 miles. And we've seen some amazing results from that. And so if you want to go to the next slide. But with that, we've also had some challenges to address, like COVID-19, like some of our support groups and stuff we haven't been able to do because those are in person. Up here, we also have like a lack of internet access and also the technology education. I would love to do more Zoom meetings and have more virtual stuff, but unfortunately, we have, some people, especially even on my committee, who are like, "Oh, I'm afraid of Facebook. I don't want to do that. I don't know how to do that." And we had been looking at offering a program on technology, but that's been kind of put off to the side because we need to be able to meet with those people, in person to say, this is how you use your phone, or this is how you answer your phone, or if you want to, Zoom with your family or FaceTime, things like that. We haven't been able to do. We've had to put on hold because of COVID-19. But also, one of the things we found from our focus groups is access to information was something that they found was important and kind of lacking. We do a lot to get our information out. We use our local media, we use social media, we put flyers out, things like that. And people still are like, I don't know about that. I didn't see that. And so it's like, do we need to have a town crier come out now? Go back to those days where they're out with the bells and hollering that we're going to have an age-friendly meeting or something like that. But really, we're doing everything that we can to try to get information out, and be creative about that. But that's something that we want to make sure that people do have that access to information, and what are some of the best ways to get that information out so that people know what's going on in their communities and that they have these resources. And then also getting some of our ideas to reality, getting that fire lit under our volunteers so that, they're going to be willing and wanting to go out there and help with some of that stuff. And some of the quick win projects help with that. But I think once we really get that action plan in place and we know exactly what direction we want to go in, then we can really focus on getting some of those ideas into reality. And then, like I had mentioned, we are working on our action plan. One of the things we want to do that I've seen is a huge need up here is that learning about technology. And so that people can, that will help with isolation, it'll help with civic engagement, it'll also help with access to healthcare because, telehealth is becoming a bigger thing. And we're even using that here in like Pines Health Services and at Cary Medical Center. And so if people understand that you can have, an appointment with your doctor, through your phone or your computer, and that can save them needing a ride, it can save time, and it's just something that we feel is really important. And then also doing more with some age-friendly meetups once we're able to meet in person again. I think it's going to be really important to get people back together and being able to be with each other again. I feel like we're really missing out on that interaction, and isolation has become a real serious problem. So as soon as we can get together, we want to do it. And then also transportation. We have a grant right now through Cary Medical Center where we're trying to get a volunteer-based transportation system up and running. And then also partnership with our Caribou's downtown team so that we can all work together to make our downtown more livable in terms of fixing up our sidewalks and storefronts and things like that. So those are some of our big projects for the future. And then also for our future, one of the things that I love about this is, and then I ask people when they come to our meetings, is what motivates you to make our community more age friendly? Or what do you think age friendly is? And so, like these little guys here, age friendly is fun for all ages. It's a great place to live. For me, it's a place that's going to be wonderful for my kids to grow up, but it's also going to be a place where my parents can come and live with us, and they can, have, a wonderful retirement and a place where I can retire and grow old. So that to me is our future. And then also, we're looking forward to hearing from you. If you have any questions about some of the work that we've done, and or how you can get started in the age-friendly community or any of the programs that we've done. One of the things that I will admit, I've taken ideas from other communities, they're happy to share. We're all working together, and that's something that if you saw an idea that we're working on and you want to implement it in your community, you can get in touch with me. Also, like, I will give Saco a huge shout out. They have a wonderful program. Jackman is another small rural community. They've got a strong team going. And then also up here, Limestone, they've got a great team going. We've got places all over that are doing some wonderful work. And so, did we have any questions?
Thank you both so much for that presentation. I love the picture on the last slide too. Well, a reminder for people, if you have questions, to please use the ask feature to enter those. But I'd love to kick us off with some. And so thinking about capacity and resources that are needed to start an age-friendly community, what do you recommend that organizations have in place? And is there any particular type of organization that's best to be the host?
So I'm going to start, and then I'm going to give a very soft handoff to Elizabeth. But some of our so before an age-friendly committee, before a community joins the age-friendly network, I think it's pretty important to have a group that is dedicated to the idea of making age-friendly changes, that really has an understanding that age-friendly is friendly for people of all ages. So I think that's important. And then it's important to have municipal support. In order to join the network, your municipality has to sign a letter of commitment saying that they will include an aging lens in age-friendly community and economic development moving forward. It doesn't promise that the municipality is going to give you any money. They're just saying, we know what you're doing, we're excited about it, and we support it. So those are the two things that are important to get it started. You need to have a group of people that want to see change happen and that understand that age-friendly is age for all ages, and that it does include older people and frail older people, but it also includes, we just had a new baby born October 2nd, a new little grandbaby, and she's absolutely adorable. But an age-friendly community is a great place for little Sassy, and it's also a great place for my 98-year-old grandmother. So very important to keep all that in mind. In Maine, in rural communities, some of our most successful backbone organizations have been healthcare, because I think that there's a big emphasis on public health here in Maine. And so, for example, in Caribou.
Yes.
Elizabeth?
Because I work for Cary Medical Center, and but one of the things that was great is my supervisor, Bill Flagg, is always looking for new opportunities. He's one of those people that sees something's missing in our community, we need help with it, and he just goes digging to find grants or support from anywhere. And he's the one that found the age-friendly communities, and we worked with our city council. They said, yeah, this is great. We were able to get a small grant from AARP that helped us with kicking things off in terms of doing the survey and the focus groups and stuff. But our whole committee is volunteer. It's volunteer based. So I'm really the only one that's kind of attached to the hospital, but everything else is volunteer based. And then also I present, to the city council and keep them apprised of what we're doing, because we do have that support. And then also we have such a good recreation program here, and I think that there are a lot of communities throughout Maine that have that as well. And so our rec program is great, and so we have that team kind of in place, and they've been a huge help and are ready and willing to help us, especially once we're able to kind of leave our homes again. But but that's something I look at what is out there in your community and see what is already working for you, and maybe you can kind of tag on with them.
Thank you both. That's really helpful advice. The next question we have is around the changes in and adaptations you've had to make with COVID-19. Are there any of those that you have found have been really successful and that you'll keep doing, perhaps even as the pandemic or when the pandemic comes to an end?
Well, for me, one of the things is our social media. We have the Age Friendly Caribou page, and then being able to get information out through that, we've seen some good interaction and people sharing our information. And I know that there are still quite a few older adults in our community that aren't engaged on Facebook, and so we're kind of missing some of them, but we're starting to get more people on board, and so using that tool also, just using our local media too to get information out and let people know that we're still working. I know some communities are using Zoom and are doing that well. That's one of the things that we're going to try to do with our next meeting is Zoom. I know some of our committee members are a little hesitant, but I think if we just kind of like the little mama bird and the baby birds, you push them out of the nest and we're going to let them fly. But if, that's something that we can walk them through and hopefully use that as a resource too going forward, because up here during the winters, people don't like to drive. And then also it gets dark so early and they definitely don't want to drive in the dark. So if we can use Zoom as a meeting tool, that is something that we're definitely going to continue with.
And so not little, but fairly small, Madison, Maine, they started a public access television program where the coordinator records interviews with various people in the community, and it's a way that they can spread the word even though they're physically distanced. And I know that they intend to keep that up after the pandemic. In a lot of the communities, what they've done is they've been able to engage new partners. So I mentioned with the commodity food boxes that Age Friendly Saco was able to engage the local police department, and now there's a member of the police department who's actually serving on their committee. That's a win, and that'll continue. Several of our communities have identified new sources of funding, and now that they've established those relationships with those funders, they'll be able to continue that post-pandemic. It's exciting to see how communities have adapted. One community, Sullivan, Maine, went ahead and they decided, we want our volunteers to still feel like they're a part of the community and that they have an important role in the community. And we know that people who are in the community are really missing all their celebrations, like they're missing their birthdays and they're missing their graduation celebration. So what they did is they had the people who were on the Age Friendly Committee write handwritten birthday cards to everybody in town who had a birthday or who had a graduation. My understanding is that they intend to keep that up. Although when pandemic is past, they also would like to have a community-wide birthday celebration every year, which of course they can't do right now. So it's been interesting to see how the communities have adapted and really had an opportunity to learn new ways of meeting the needs in their communities.
Thank you both again for that answer. I'm wondering if you could talk a little bit more about the barriers around transportation. And I think this relates to COVID as well, with a decrease in volunteer driver options for folks. But could you talk about the partnerships that you have with transportation and how you address that and its impact and effects of COVID as well?
Yeah, I'll go ahead and start. We have a community block grant right now, and to kind of create a volunteer driver program. But like you said, with COVID, we've had to kind of stall some of that because we can't get together to offer training, pulling the volunteers together, and of course with them offering the rides. Also in Presque Isle, they had a bus that was the Presque Isle Loop, and that has been, they've had to stop that because of COVID. And so it's really something that has been a struggle in our community, because we have people that live right in like downtown Caribou, and you can walk to the library and the grocery store and things like that. But if you're out in Woodland or New Sweden, you have to drive places. And so it really is a struggle for some of these people. And like we had last year, a gentleman who called a radio station because he had run out of food and was snowed in. And so he had been boiling snow for water. And so that's when the community was like, we had no idea that something was going on. So we went out, plowed him out, and were able to kind of help him. But in terms of the whole transportation thing, it's trying to figure out that answer to it. But really, the thing that I employ people to do is who your neighbors are. And like I know that like my neighbor is an older woman, and she doesn't get out much. But if I suddenly see that her driveway hasn't been plowed for a while, or I think that something might be wrong, just keep your eyes out and go and knock on the door and offer assistance. And sometimes people are hesitant to take help, but if we can work with also like our churches and other groups, to kind of keep an eye on what's going on with your neighbors, and that way so families can know and everybody knows that someone needs help, and then we might be able to offer a ride, because I know that you can still if you're wearing masks and using hand sanitizer and stuff like that, you can safely give someone a ride if needed, because we still have taxi services and stuff that are working. But really it's that whole just keeping your eyes open and offering help when needed.
So what we have been hearing from the volunteer transportation programs is most of them at least shut down for a couple of days when COVID first became generally known. Some of them so what generally speaking happened is that they would shut down for a little while, and then they would have a meeting because they knew that there were community needs. They knew that, for example, the transportation to the local grocery store was no longer happening. They knew that the congregate dining was no longer happening. They knew that a lot of the delivery programs weren't happening immediately. So it was very important to address food security. So that became sort of their reason for existence. And what they did is they did curbside pickup, and then they would bring it to people's houses and they would leave it outdoors. One of the volunteers that I spoke with recently who was involved in that project said, but we knew how important it was that people would see a smiling face, so they would let the people know that they were delivering it and tell them to stand behind the door so that at least they could see the person who was making the delivery, make that little bit of contact. Recently, some of the volunteer transportation programs have started providing rides. What they're not, generally speaking, what they're not doing is providing social rides. So they are providing rides to medical appointments. One of the reasons is that there's a real lack of volunteers who are willing and able to provide those rides. So what they're doing is they're limiting to medical appointments, and they are still making deliveries. We do know of at least one volunteer transportation program that doesn't plan to open up again. As far as they're concerned, they're did and done. So it's exciting for the small little programs, especially the ones that kept on going. It's really encouraging to see that and to see their level of dedication. And a lot of it is exactly what Elizabeth said. You know, these are small communities in Maine. And so if I'm Sally Joe and I'm providing rides to Bill and Karen and Mary Beth, those are my neighbors. Those are the people that I care about. And so I think that's one of the reasons that these small volunteer transportation programs tried to meet the need in every way they possibly could, because they do deeply care about their neighbors.
Thank you both. And I know that's one thing that you guys are great at doing in Northern Maine, especially, and is taking care of each other and reaching out and offering that support. So that's great to hear. It doesn't look like we have any more questions at this point. So I want to thank both of you for being here to present this morning. We've really appreciated learning about it. And you know, for those folks who are listening in the audience, please reach out to Elizabeth and Patricia to start your own age-friendly communities in your neighborhoods. Please don't forget to take the session evaluation. It's really important, as I've mentioned, and we appreciate your feedback in doing so. We will be back at 12:20 with another presentation on isolation and aging. So please join us then. And otherwise, take a lunch break, and we'll see everybody back here in about 15 minutes.
Thank you.